You all set? Okay, parents, thank you for joining us this afternoon. I do have some pertinent information for you. Hopefully you will like what you hear, and more importantly, I hope that it will bring clarity to the things that we're doing here in the school district in terms of parent and student screening. So this has been a topic of a lot of discussion to date. And we want to make sure that you have the best information. So as you know, this year, all ICS faculty and staff will undergo health screenings before they report to work in our district. So for the health and safety of our students, the local health department also requires that students be screened for symptoms of COVID-19 before they enter school. Being able to continue our face-to-face instruction will depend on all of us working together to assure that everyone in our buildings is safe and working to avoid any potential COVID-19 exposure. So if you're in this Zoom or if you're watching this recording, my assumption is that you have a student in a face-to-face situation, or that you've enrolled your student, and that's important to you. So we're really going to solicit your help here. You can make all the difference by committing to working with us on this endeavor. Right now, the health department locally at the state level and at the CDC don't currently recommend that there be a universal symptom screening conducted by school personnel right on our site after students have already reported to the district. Rather, they recommend asking parents to conduct health screenings at home before students are even sent here, and then really that makes the most sense. The recommendation is designed to avoid an inordinate amount of time and interruption that a universal screening outside of the buildings would impose on our educational programming. You can imagine with almost 2,000 students trying to conduct outside temperature taking before anyone enters a building. It really is not feasible. It would promote conditions that are not optimally safe anyway. This is also designed to safeguard the privacy of your child's health information and to not have students screen in front of one another as much as is practical and possible. So we want to adhere to that. That does not mean there wouldn't be times where we would take a student's temperature, but typically that would be if they felt ill or were down in the office with office personnel. And the last part of that is to eliminate the chance of exposure or transmission of COVID-19 by assuring that students don't even board a bus or don't even come to school when they're ill. So, so doing this before school is key. As a result, we're asking you, our parents, to partner with us to conduct these screenings before sending your students. So in addition to asking you to commit to this daily screening for the 2021 school year, or until the school district or the health department indicates that screenings are no longer needed, as a partner with us, we're asking you to understand that that it is a responsibility not just to your child and yourself, but to everybody that wants to be in a face-to-face instructional setting this fall and through the school year. Also, we're asking for your partnership and communication. So we are trying to communicate as best as possible to our parents needed information, but we're also asking that you would make sure that you communicate with us. So if you conduct a screening and you have a question, we would ask that you communicate that as soon as you have the question. More importantly, if you have a child who is ill or who you've answered yes to one of the questions on the screener, that you communicate immediately with the school district, both to report an absence, but also to report student symptoms. And that will help us keep our other students and our staff safe. And if you really think about the scenario of having all of our students back together in a face-to-face scenario, which I think will be great for them, we're also talking about the safety of extended family and people that you have at home and people that you come in contact to. So this is a true opportunity for us to accomplish something that we want to be able to do for students and that you want for your student, and also to safeguard the well-being of the greater school community. So that is much appreciated. So I will be sharing my screen with you now, and you should be able to see, and I know that Dr. Tallis will indicate to me if she can see my PowerPoint. Okay, this is a quick PowerPoint that will go through some of the elements of the screener and why we are conducting it. I talked a little bit already about the purpose and background, so I won't spend more time there, but suffice to say, if we want to be face-to-face and we want to continue to be face-to-face, screening is the key element in terms of what we can do to make sure that everybody at the school is healthy and remains safe, and that we're able to continue to conduct face-to-face learning. A little bit more of the purpose and background. Again, this is for everyone's safety. But I did want to communicate to you that this was not created by Imlay City Schools in isolation. While this is an Imlay City Schools document, we definitely consulted with the State Department of Health and Human Services, with educational leaders across the state of Michigan. We consulted the Michigan Return to School Roadmap, which is a really comprehensive document that's been put out by the state of Michigan through the governor's office, and most notably, in cooperation with the Lapeer County Health Department. They were really able to lead us through what would be important information for parents to collect on a screener and give us ideas about how that might be best accomplished. I have some information about how the screener relates back to the preparedness plan that we put out earlier and covered with you. And I'm not going to cover that right now. I'll save that for Q&A if we need to refer back to it. So before we get on to questions, I am going to stop this share very quickly and change my screen so that I can actually review with you the actual screening document. Dr. Tallis, are we good to go there with the screener? Okay. So this is the actual document that we will produce for you. We'll put it online so that you have access to it anytime that you want, and we'll make sure that it gets sent home with you. It's broken into 3 specific sections. The first one has to do with symptoms. And what we're asking you to do is screen your child for the following symptoms. The first is a temperature of 100 degrees, 100.4 degrees or higher. If your child has that temperature, that could be associated with COVID, and we want to make sure that you are keeping your child home in that case. I have great news for you. Imlay City Family Practice, Dr. Laura Zelenik, who is one of our local physicians, has decided that through her office, she would provide every parent of every student who is in face-to-face instruction a digital thermometer. We have those here in the school district, and we're very thankful for that generous donation. And we'll make sure that those get home with students on day 1, so that if you feel like you don't have a dependable thermometer, Imlay City Family Practice and Dr. Zelenik will have provided one for you. The second symptom is a sore throat. The third symptom, new uncontrolled cough that causes difficulty breathing. For students with chronic allergic or asthmatic cough, a change in their cough from their baseline health would be a response that would be yes to this section in symptoms. You'll notice that it specifically says new there in bold. The reason it says that is because, much like Dr. Cameron, many students have seasonal allergies. And in a season when there is a lot of corn pollen in the air, I have a chronic low cough and runny nose. And I know what those are. That's part of my baseline health, and I understand that. As a parent, no one has a better understanding of your child's baseline health. And so that you will know and be able to distinguish between a new developing cough that causes difficulty breathing as opposed to some element of your child's baseline health. The next symptom, diarrhea, vomiting, or abdominal pain. And below that, the new onset of a severe headache, especially with a fever. So this would not be part of a cycle of migraines that students may experience, and we have students that do experience those. This would be the new onset of a severe headache. So reviewing section 1, there are 5 symptom categories there, and we would ask in the morning that you first take your child's temperature and that you examine them for the other 4 symptoms. If the answer is yes to any of the symptom statements, has your child exhibited the following, then you should keep your child home from school and consult with your healthcare provider as needed. You should also call the school as soon as possible to report your child's absence and the reason for that absence. The reason that we're asking for the reason for the absence is so that we can help you as you walk through this era of COVID-19 and can provide you better information about how maybe you can take next steps with a child. Section 2 is simple. It says this: in the last 14 days, my child has been in close contact within 6 feet for at least 15 minutes of a person who has been clinically diagnosed with a case of COVID-19. Close contact, this definition is the same one that I shared earlier when I reviewed what we would do in the case of a positive case of COVID-19 affiliated with a school district. 6 feet for at least 15 minutes with someone who is clinically diagnosed. That it's not a speculative case, that is a doctor, a clinic, a medical professional has conducted a test and diagnosed that case. If the answer to section 2 is yes, then you need to keep your child home from school, consult with your healthcare provider as needed, call the school as soon as possible to report your child's absence and the reason for the absence. The health department has instructed us that in a case where a student or a staff member has been in close contact with someone who is clinically diagnosed with COVID-19, there would be either an isolation period or a quarantine period that would be mandatory. And we can instruct that to you or instruct you of that if you find that your child has been in this scenario. Section 3 has to do with potential exposure. In the last 14 days, my child has had close contact, again, 6 feet, within 6 feet for at least 15 minutes with a person who is under quarantine or under a watch for possible exposure to COVID-19, or my child has had a travel history to an area with high community transmissions per local or state health departments. Those answers yes to those two questions in and of themselves do not constitute the need to call the school, and they don't constitute a need to keep a child home. However, they exist because if they are paired with one of the answers for section 1, there are specific steps that you would want to take. To review those, if the answer is yes to any of the statements in section 1, and remember those are the 5 symptoms that are highlighted there, but no to all of the statements in section 2 and all the statements in section 3, you should keep your child home from school until the following are fulfilled. In the case of a fever, that your child has gone fever-free for at least 24 hours without the use of any fever-reducing medications. In the case of a sore throat or cough, that there is significant improvement. If it is strep throat, obviously you'd follow our regular procedure, which is not to have your child return to school until at least 2 doses of antibiotic have been taken. In the case of diarrhea, vomiting, or abdominal pain, that would mean there is none of those symptoms, no diarrhea, no vomiting, no abdominal pain for at least 24 hours. In the case of a severe headache, that would be significant improvement in the headache. Obviously, you always want to consider consulting with your child's doctor when your child is sick, especially in the era of COVID-19. And please also make sure to call the school as soon as possible with these symptoms that were named above to let us know that your child won't be present and to discuss those symptoms with us. So, going back to section 1, these 5 symptoms, the fear of many parents, I think, has been, if my student has a runny nose, does that mean that they'll be out of school for 14 days under a watch? Or if they get a sore throat, or if they have a cough that's associated with their allergy, will they be made to stay out of school? And the answer to that is no. It's no under the conditions here. So if you mark yes to any element of the screener for fever, sore throat, cough, diarrhea, vomiting, abdominal pain, or severe headache, these are the indicators that would need to be followed, or the thresholds that would need to be crossed in order for a student to return from school safely. Getting back to the thing that I mentioned before, if the answer is yes to any of the questions in section 1, the symptoms, any of them, and yes to any of the questions in section 2, close contact, or section 3, potential exposure, then you should call your healthcare provider right away and get evaluated, get your child evaluated, and discuss potentially being tested for COVID-19, because the combination of elements in section 2 or 3 paired with any of the yes answers to the symptoms that were there at the beginning of the document could indicate potentially having contracted COVID-19, and you would definitely want to rule that out. in your conversation with the school, then we'll work together to work with an amount of time that a student would need to be out of school, and be able to give you the specifics. That part we'll have to deal with on a case-by-case basis. Although if you have a suspected case of COVID-19, you can expect for your child to be out of school for some length of time. So that is a screening document. Again, I'll just review 3 sections. 1 has to do with symptoms and includes taking the temperature daily. 2 has to do with close contact or direct exposure. 3 has to do with potential exposure. And then there are answers about how to react if there are yes responses to any of those items. So that is everything to do with the screener, and I can put it back if people have questions, but we are at the point in time where I can take some Q&A, and I've asked Dr. Tallis to collect those. So Dr. Tallis, do we have specific questions I can answer?
We do, and some of these were collected as part of the registration process
Okay.
for the webinar.
Okay.
This one, I believe that you answered, being in a rural area with lots of farming, allergies are big in our family. Will that be taken into consideration for symptoms such as congestion and sneezing that align with allergies?
Absolutely. So I hope I covered that adequately, and whoever you are, I sympathize greatly. If you know where my office is located, there's a huge cornfield right across the street on 2 corners, and I am allergic to corn pollen. So there are times of the year where I'm absolutely miserable, and yes, we would allow for that.
If there are no symptoms of fever or infection, will a COVID-19 test be mandatory by the school before returning to school when it's not obviously allergies? So I think the question is, are we going to be the one to require a COVID-19 test?
We will not be for the symptoms that were listed in section 3. If you have symptoms in section 3, and if your child has had symptoms in section 1, those 5 symptoms, so you've answered yes to 1 or 2 of those, and you answer yes to either section 2 or 3, that there's been a possible exposure or a confirmed exposure, then the health department will give you a strict guideline that we will help communicate to you.
Okay. What will be mandated in regards to reporting of COVID symptoms to the Lapeer Health Department?
We will not report any COVID symptoms directly to the health department. In fact, we will not be reporting anything to the health department unless we get the first report that someone is COVID positive. So in order for that to happen, you would have had to have a clinical test. And when that happens, the health department, if your child is tested in Lapeer County, the health department is notified typically well before the school would be notified, and the health department contacts us. If a child is sick with one of the 5 symptoms, they have a high fever, or they have diarrhea, vomiting, or abdominal pain, a headache, if they have a new developing cough, and you call the school and say, my child will be out today, I've taken the screener and it says to keep my child home. In addition to that, these are the symptoms. There's no mechanism by which the school communicates directly to the health department. That stays confidential information with the school district per what we already typically do here in the district. So the communication doesn't happen that way unless you were to call and call your child's office and say, my son or daughter has had a COVID test and has tested positive for COVID. Then the school office would call me, and I'm the liaison to the health department, and I would call the health department and say we have a student's parents who's reported a positive case. And like I said, if you've been tested in Lapeer County, typically they would have notified us first before you would have notified us.
Could you talk for a minute about the school's role in contact tracing?
Yes, that's a great question. So it will be incumbent upon the school to participate with the health department in contact tracing. And what that means is, if there is a student who is diagnosed or a staff member who is diagnosed with COVID-19, the health department will be alerted. They'll reach out to us and they will say, Dr. Cameron, Joey Smith has developed a case, clinically diagnosed case of COVID-19, and we need to make sure that we're doing contact tracing. You can help us inside the school, and we have an actual contact tracing form that I'll sit down with a principal and a teacher and say, you're Joey's teacher. Let's brainstorm who have they been within 6 feet of for at least 15 minutes for up to 48 hours before they left school or before they experienced symptoms, and we'll rebuild that. We can do that. Remember, we have cohorting at the elementaries. We have assigned seats on the buses. We have cameras in the cafeterias and in the hallways, and we'll be able to assist with building that list. Now, contact tracing for family members, obviously we can't do that. We can't participate in that, and the health department would do something very similar. They would sit you down as a parent and say, okay, who in your family has been in a close contact? People in your household? Is there extended family with whom your child has had extended contact or would be a close contact? And then the health department helps communicate to close contacts to alert them that they were a close contact of someone who's been positively identified.
What type of mask will be provided at school for kids?
Okay, so I believe, and Dr. Tallis can correct me if I'm wrong, that some masks have already gone out in school mailings. Has that been done in every level?
No.
Okay, so I know at the high school, masks have already gone out. There are 3 different masks that we'll be using here. Now remember, our expectation is that parents are providing masks for students on a day-to-day basis, but that we will provide some to get students started. So, so students will need a mask when they report to us. If they're going to ride a bus, they have to have one to ride the bus. We have a Hanes produced cotton mask that is an over-the-ear cloth mask that we can provide. We also have some emergency masks. So if your child is here at school and they take their mask off at lunch to eat and they spill their drink on the mask, we have 2 different types of masks. We have a paper surgical mask that are child size, if it's a younger child, or adult size for older students. And we have a cloth mask that is uniform shirt type material. That's how I would describe it, that we get from Cintas with elastic over the ear. And students can use those in emergency. They can wear those throughout the day. They can take them home and bring them back to us the next day and put it in a receptacle at the school, because those are sent back to Cintas, and Cintas will take those and they use hospital sterilization type equipment to clean and launder those masks.
So speaking of masks, several of our elementary students did not have masks in their packets because we were waiting for the correct size masks to come in.
Right.
So those students who did not get a mask in their welcome back packet will get those on the first day of school.
Correct, along with their thermometers to take home.
Will families be notified if a classmate has tested positive?
Yes. Yes. So we are not allowed by law or common sense to distribute the name of a student or a staff member who has tested COVID positive. That's actually against the law to do. But if you are in a classroom where there has been an affected student, you'll get a communication. If you're in a building where there's been an affected student, you'll get a different communication that will indicate that your student was not in the classroom, but that there was someone in the building. And if you are a parent of a student in the district, you'll get a different communication that will say we've had one student or staff member who's tested positive in the district. Now remember, if your child has been directly exposed or is a close contact, meaning within 6 feet for at least 15 minutes of someone who's clinically diagnosed, you'll get a direct communication from the health department, and they will walk you through some additional steps for monitoring your child and some suggestions. So yes, communication will be provided.
Will siblings be required to stay home if there is a positive in the home?
Yes, if they are a close contact, and the assumption I think of the health department will be that if a student lives with someone who has been a close contact, so let's say it's a sibling, brother or sister, they would be required to stay home. Now, if they are symptom free, the health department will advise that that quarantine be for 14 days. If the child has a symptom, then they will start a clock that starts ticking at the onset of symptoms, and that child would have to stay home for minimally 10 days and not return to school until there is no fever without the aid of fever reducing medication, that the symptoms, COVID symptoms, have resolved, and that 10-day mark has passed. But the health department will have to be the arbiter to explain which of those two scenarios would fit.
Can you explain one more time how they will receive the thermometers that were donated?
Yes. So your child will be provided a thermometer. It's a digital thermometer that's in a little box. Teachers will distribute those to children. If they're young children, they'll make sure that those get into bags that go home with a note that says this has been provided to you by Inlay City Family Practice. And on the back of that note, we will actually attach a copy of the screener.
There's been a couple questions about homework distribution if students are kept home due to symptoms of COVID.
Mm-hmm.
Do we know how that will work?
That will vary from circumstance to circumstance and from probably elementary to secondary, how that will look. Initially, if it's a singular student that has to be out, we'll conduct that work the same way we do when students are out for 5 days with the typical flu, or if they are homebound for a short period of time, where teachers will compile work and provide that for pickup by a parent. If an entire class, and this is unlikely, but if an entire class was to have to be out, one of two different things could happen. So we have purchased Edgenuity. We can provide some online learning as well as some hard copy learning. If a student is out typically for a day or two, so let's say that your child is experiencing a sore throat, and that lasts for 2 days, and on day 3 the student is feeling better, the sore throat has significantly improved, and you determine they can return to school. That may be a scenario where the student returns and does some makeup work with the assistance of the teacher, as opposed to something being sent home. So it would depend on the length of the stay out of school and the level and the resources available both at your home and at the school. But work would be provided. So we won't have a scenario where students would be out for 14 days on a quarantine and would sit and have nothing to do and then return and have 14 days worth of makeup work. I think that's an unreasonable expectation of any young person. We wouldn't put them in that scenario.
To clarify, if a classmate or teacher has a diagnosed case of COVID, will the whole cohort or classroom have to quarantine or isolate?
No, that's not required by the health department. The standard that is used is anyone who is a close contact being within 6 feet for at least 15 minutes during the infectious period of that individual would have to be quarantined. Now, again, that may mean different things at different levels. So remember, we do have elementary classrooms are cohorted, and they spend an entire day with the same adult at the front of the classroom, or most of the day with the same adult at the front of the classroom. If an elementary teacher was diagnosed with COVID, then we would conduct contact tracing immediately and say which students would qualify as a close contact, and those students then would have to be quarantined for a period of 14 days. That being said, in an elementary classroom, could it be an entire classroom of students? That is possible. I don't know if it's probable or not, but that is possible. If that is, but it won't be mandatory. Now, the other thing that I need parents to really understand is we're living in an era with a global pandemic, and you can make determinations about your child's attendance and what the reasons are. If your child is not a close contact of someone who is positively identified, and you believe that it's in their best interest to stay home, then we'll respect that decision. And we'll work with you to make sure that they have adequate work.
Um, if you have a split household, with some students in school and some at home, can they come in for school pictures or to participate in any school events if they're the students who are at home?
Yeah, I think I understand that question. So this would be a scenario where you might have some students that have elected, or you've elected for them to be virtual learners as opposed to on-site learners. Would they be able to attend a soccer game, for instance? The answer to that is yes. That would function just like it would normally. However, you have to understand that there will be very few events this fall because of the mandates of the back to school roadmap. So right now we don't really have any large congregations or events of that type. Your question about pictures, what I would ask you to do is to refer to the building principal at each building in which you're interested in taking pictures. If we have virtual students and they are interested in doing that, we will accommodate that. But I do want you to have a conversation with the principal, because we'll need to know that a student would be coming in that typically wouldn't be in seats or in a classroom seat that day, and make sure that they can review what the screening, not only the screening will have to do, or what procedures your student will be accountable to in order to enter a building and get a picture taken. So for that, I would ask you to please call the office of your student's grade level school.
And the last question we have, Dr. Cameron, what will the process of switching classes at the high school look like?
Okay,
with
so
social distancing and staying 6 feet apart.
right. So if you'll remember back, I don't know if who asked this question or if you had an opportunity to sit in on our original back to school preparedness plan meeting. But I did talk quite a bit about the idea of being optimally safe and executing practices that are feasible. And there are some things that are feasible for us, and there are some things that are not feasible for us to do. Our best tools for student safety and staff safety, especially at the high school or secondary level, are these three: an accurate screening in the morning by a parent, proper hand hygiene throughout the day, and mask wearing. So what will happen is the bell will ring, and students and staff will have cleaned their area, made sure that the desks are clean, that the classroom is clean. They will proceed to the hallway. Remember, everyone at the high school, including the adults, will be wearing a mask for the duration of the day, except for at lunch. And they will have a mask on. They'll be supervised by adults in the hallway. And the other thing I would ask you to remember is that at the high school, I believe the passing time is just over 4 minutes, which is pretty quick. So that is a quick stop to the locker and then a quick exit to the classroom under the supervision of adults in the building to make sure that students are not congregating.
And that is all we have time for. A couple last questions came up about school building open times, and I would refer parents back to their welcome packets. That information was included in your welcome packet. If you can't find that, please call your building principal, because, for example, students that would typically enter the middle school or high school super early before school starts, that is not, we're sticking to a pretty tight building schedule to alleviate time for congregating to occur.
I would close, Dr. Tallis, if I can, to our parents and say thank you. I know that everything's been high anxiety since last spring. And while I do believe that the communication I've been getting from parents is they're very much looking forward to the start of school and some face-to-face instruction and online instruction, that there's always a little bit of a level of anxiety. We will do our best to make sure to alleviate that. Hopefully communication will aid with that. But I want to thank you for your patience with the school district as new information comes in daily. Dr. Tallis and I spent the morning redoing some documents and some procedures and protocols that we had heard, received some information from the state just this morning that some things had changed And these were instructional things, nothing that you would need to worry about, but things that are changing in our world on a day-by-day basis. And I know that that's hard on people. I understand that that creates anxiety. I know a number of our parents are planners, and you like to know exactly what's going on as soon as possible so you can make your plans. And so I would say to parents, you've exercised a tremendous amount of patience with this situation, and that we certainly appreciate your understanding as this landscape shifts and evolves. And hopefully you're finding the information that you can, or getting the information that you need from us. So thank you for that. I want to thank you also in advance for being a partner in this endeavor. So screenings will be critical to make sure that we can stay in face-to-face instruction. And I thank you in advance for conducting them, for communicating with us as well. So I hope everyone has a great afternoon. If you have additional questions, you can get a hold of us or get a hold of the office of your child's grade level building, and they will be able to answer any of your questions. Thank you.